Diseases of the nasal septum, Dr. Fire. Let's see. Okay, so septum is like the part of the nose which is between the two nasal cavities. So that is the septum. Septum can have a lot of diseases, like it can be deviated. So usually the septum is in the midline in 4 in 5 people, but 1 in 5 people is special. So that person is going to be having a deviated nose. So like the nose is just like tilted. So it could be like family nose or something, but obviously, yeah, that could be happening. But something other than just a deviated nose, there could be a chance of a blood clot present inside of the nose. It's called a septal hematoma. But sometimes this blood clot can get infected, so it is called a septal abscess. But sometimes you can get other diseases like a hole inside of the septum, so it's called the nasal septum perforation. So this particular video is going to like focus on these main diseases. All right, so like sometimes you can also get into a fight and get a nasal septum fracture. Let's start. The first diseases of today is DNS, which is deviated nasal septum. Deviated nasal septum can be because of hereditary causes, for example, it's a family nose, or it can be racial factors. The etiology of it can be a racial factor, which is nothing but Caucasians will have more chance of a DNS. Well, in a previous video, if you have seen the video of the external nose, you would know that the Caucasians' anteroposterior diameter is very high. So like when they're going to pass into the genital passage of the mother, these people are going to like get DNS. I mean, that's just one of the causes. Otherwise, you're just like inheriting your family nose. That can also be a cause, but honestly, we don't know. Nothing is certain in medicine. Anyways, the other cause of DNS is just like you got into a fight when you were a kid. So like trauma, unattended childhood or birth injuries, DNS manifest in later life. Because like as the child grows up, the deviation will become more and more prominent. Septal hematoma is spontaneous bleeding, can happen in, it's not blessing disorder, it's bleeding disorders, and nasal trauma, septal surgery. So like anything you're gonna like disturb the septum is gonna start bleeding, as simple as that. And then septal abscess is because of a secondary infection of the septal hematoma, or it can be from a spreading of an infection. So like a furuncle or a boil can be there in the nose, or it can be in the area around the nose, like the upper lip. From there, the infection can go into the nasal septum, and that is going to cause like an abscess. Right. Apart from that, there can be septal abscess can occur as a result of lowered immunity, post TB or post typhoid or post measles sequelae. So just look at this picture, because too much text, we will see the picture. So like this is a teenager, so I'm assuming he's a teenager. He got into a fight and he's got like, it kind of looks like nasal fracture because there is redness, there is swelling, and like there's some sort of a plug which is like underneath. So possibly he was bleeding. That's why they put a chalk piece or like a cotton plug. It doesn't look like a cotton plug. It kind of looks more rigid, right? So that is nasal fracture. So obviously there's bleeding. So you have to like treat the fracture, correct the deformation, the deviated nose secondary to that, and that's going to be the plan for this patient. This patient is having a deviated nasal septum, so that's like, once again, we know the causes of it. It can be like a family nose, or the person is like during birth or like after birth there's some trauma, it was unattended and he got a deviated nose. And so like this is called a Cusco speculum, very famous speculum which is used in ENT. Okay, it doesn't look exactly like that, but okay. So if you're gonna like touch the tip of the nose even with your thumb, like the doctor's thumb, and lift up the nose, you'll be able to get a clear picture of the nasal cavities and also the septum. So like this pinkish swelling, which is kind of like on both sides of the septum, right? So technically it means like the swelling is present in the septum. So this is a hematoma. Hematoma and abscess looks almost the same, except that hematoma is more of reddish in color, abscess is more of pus in color, like yellowish in color, but you can't really differentiate unless you can get access into what is inside of it. So this is how a septal hematoma looks like. A septal hematoma is not as painful as an abscess, because abscess is like pus, and pus everywhere is like just painful. So I got a boil in my butt. So that hurts a lot. So this is a Cusco speculum. Yeah, it's a very famous speculum used by ENT surgeons. So that's how you see a nasal septum perforation. So like there could be like a numerous reasons why a hole happened on the septum. So that can be because of you are just a violent person. So like it's just like habitual nose picking can cause it, but sometimes you are like, you know, yeah, let's go for nose piercing kind of person. So like you got a nose piercing and there's, yeah, perforation. Or sometimes you did not even want this perforation to happen, but like your doctor gave you the perforation. So like while doing some surgery, he did some thing wrong, okay, and you got the perforation. So let's get back to the etiologies. Nasal, yeah, septal abscess is over. Nasal septum perforation, it can be a small hole or a large hole. So the mnemonic is T-dip, okay, T-dip. T for trauma, so like trauma can be because of, I already said, the ornaments, habitual nose picking, injuries to the mucosal flaps because of SMR. SMR is an operation which is called submucosal resection. So that's done for like a DNS. So like you're gonna go to the doctor for correcting DNS, you're gonna end up getting septal perforation. Not all the time, obviously, but like there is a chance. Drugs, okay, yeah. T for trauma, right? So like sometimes you're gonna like cauterize the septum a little too much. So it can be an electrocautery, otherwise called a galvanocautery, or it can be a chemical cautery. Right. I want you guys to comment down the chemical cautery in the comments below. Right? Okay. D for drugs. Drugs like cocaine, so like cocaine, chromium, arsenic, and prolonged use of steroid sprays. Well, this is a very nice phenomenon. It's called the cocaine bug phenomenon. I always love that phenomenon. So like if you're gonna snort cocaine, you're gonna get sensation of bugs crawling underneath your skin. I'm saying I've not tried cocaine, any other recreational drugs also. So like if you have tried cocaine and have experienced the cocaine bug phenomenon, do comment down in the comments below. But obviously we're not talking about cocaine bug phenomenon here exactly, so we're talking about perforation. Cocaine is a strong vasoconstrictor, so like it's gonna vasoconstrict too much, quite a lot, so like it kind of exaggerates the constriction, so like the nasal septum itself gets constricted, and boom, there's a hole. There's just no enough septum. And I for idiopathic, P for pathological. Pathological means some secondary causes of which are of septal perforation, or there, like for instance there's like some abscess in the septum, or there's a lot of infection. It's called nasal myiasis. It's just like worms, and like house flies, small ones, just like nasal myiasis. Rhinolith. Rhinolith is nothing but a foreign body in the nose which is undergoing calcification, so like calcium deposition out around it. It's not a stone in the nose, okay? Rhinolith sounds like stone in the nose, but it is not. It's just like a foreign body covered with calcium inside of the nose. Or other causes can be like a neglected foreign body causing pressure necrosis, chronic granulomatous disease with perforation in the cartilaginous part or the bony part. So if it's like the cartilaginous part perforation, it's because of tuberculosis, leprosy, and Wegener's granulomatosis. But if it's a bony part, it's because of syphilis. Fracture can be there. Fracture can occur because of trauma. Trauma can be from the front, from the side, from the down of the nose, okay? And Georgieve fractures, like fracture, specific name for fracture from the front. And another thing is chevalet fractures, like fracture from below. Alright, so just remember you're dropping the wallet down, so like it's below wallet. Chevalet is like wallet, and remember fit G class, so like front is a G, G is Georgieve, so like front Georgieve, okay? Remember it like that. We're done with etiologies. About the clinical features, we will see in the next video because I'm a little tired now. Okay, but like, yeah. Thank you.